Kia ora koutou katoa. Good morning, everyone. 9 COVID-19 cases reported yesterday in the Nelson-Marlborough region have now been confirmed as the Omicron variant, and a further case from the same household was confirmed late yesterday. These cases are in a single family that flew to Auckland on 13 January to attend a wedding and other events on the weekend of January 15 and 16. And initial estimates suggest that there were well over 100 people at these events. This cluster has already led to an additional infection of a fully vaccinated Air New Zealand flight attendant who picked it up on a flight 5083 on January 16 from Auckland to Nelson that the family was on. That flight attendant has worked 4 additional flights whilst infectious. We were also informed late yesterday of a further case who was at the wedding. But even more importantly, we don't yet have a clear lead on the index case that links this family to the border, as we have with our other Omicron cases to date. That means Omicron is now circulating in Auckland and possibly the Nelson-Marlborough region, if not elsewhere. On that basis, as we have previously signalled, the whole of New Zealand will move into the red setting of the traffic light system at 11:59 p.m. tonight, Sunday, 23 January. As I set out this week, our strategy is to slow the spread of Omicron down. This includes boosters and public health measures such as mask wearing and restrictions on gatherings, while keeping the pressure off our health system to protect those most at risk of getting sick. Our plan for managing Omicron cases in the early stage remains the same as Delta, where we will rapidly test, contact trace and isolate cases and contacts in order to slow the spread. Given our low number of Delta cases, we currently have significant capacity in our system to attempt to stamp out outbreaks, and our teams are already hard at work to contain this one. But as we've seen elsewhere in the world, Omicron is significantly more infectious, and in due course, we know we will see far more cases than we have in the 2 years of the pandemic to date. But the difference to previous outbreaks is that we are vaccinated and we are even better prepared. Limiting the threat of Omicron will take a team effort, like we've done before, and there is one task that I'm explicitly requesting New Zealanders to undertake as soon as possible: get boosted. The evidence from overseas is that boosters significantly reduce the likelihood of getting sick and needing to go to hospital, and also helps to reduce the transmission of the virus. Most other countries have had to get boosted in the middle of their outbreaks. Our plan has given us a head start, and around 56% of those eligible for a booster already have one. But we need to get that number higher quicker. We need to use the coming weeks before the virus could significantly take off to get as many people boosted as possible. If it has been 4 months since your second dose, you are due your booster, please go to bookmyvaccine.nz to make an appointment, or simply go to a local drive-through, GP or pharmacy. The HealthPoint website has a list of all the vaccination sites in the country. Vaccination sites are open today across the country, and we'll be standing up additional capacity this week in anticipation that there will be additional people who will now be wanting to make sure their vaccines are up to date. And for those of you with children aged 5 to 11, all children aged 5+ can now be vaccinated, and I encourage parents and caregivers to seek out information to help you make that important decision. Already around 20% of children aged 5 to 11 have been vaccinated or are booked to be vaccinated. And now a little more detail on the red settings. Every new region in New Zealand, as I said, will move into red at midnight tonight. Even if your part of the country doesn't yet have Omicron, the evidence from overseas suggests that it moves very quickly. We know it's already in both the North and South Islands, and that cases have been on a number of flights. Our goal at Red is to slow the spread of the virus Again, the evidence from overseas is those places that were slow to act have had more severe outbreaks. So at Red, in many ways, life carries on as per usual, but with more mask wearing and distancing precautions, and reducing gathering limits to lower the risk of picking up the virus and super spreader events. Red is not lockdown. At Red, businesses stay open, and you can do most of the things that you normally do, including visiting family and friends and moving around the country. But Red will make a difference because it focuses in on those events that we know are high risk. Hospitality businesses can open, but are capped at 100 people indoors, and customers must be seated and separated. Events and gatherings for vaccinated people are reduced to 100. If people at an event are not vaccinated, that reduces further to 25. In retail and public places like libraries and museums, there will be limits on those in a space based on the ability to maintain physical distancing. Businesses and workplaces remain open, but where a workplace deems it appropriate, they may choose to have employees work from home. Education centres stay open, but with extra public health measures, including mask wearing from everyone from year 4 and up. It is our intention for schools to return as planned. Over the summer, our education team has been working on additional measures to help support this safe return, including supporting the assessment of ventilation in our schools. Our plan is simple: get boosted, wear a mask in indoor settings and outdoors when you can't distance from others, and reduce contacts as much as practical in those environments. Omicron is now in more than 80 countries around the world. By delaying its arrival here, we've had the time to kick off boosters, vaccination for children, and prepare. I encourage everyone to use the coming days to take steps at home and with your family, neighbours and community to make a plan. Resources to help you do this are on the Unite Against COVID-19 website. One of the most important things that people can do is to make sure that you and your family have a buddy, a neighbour or a friend who may be able to help out with delivering things that you need if you do become unwell. Help and support, including financial support, will be available for people who are isolating. Both the Leave Support Scheme and short-term absence payment are available for people who cannot work while they are isolating. Minister Robertson is here and we'll talk more to that shortly. Earlier this week, I talked about the fact that through the course of managing Omicron, we will be taking a staged approach. As case numbers grow, both testing and isolation approaches will change in response. We've been planning for 3 stages for Omicron. Phase 1 will include the period we have up to 1,000 cases a day or less. We expect this scenario in the initial stages of the outbreak and could take up to 14 days to arrive. At this stage, we're doing what we've successfully done with Delta, taking that stamp it out approach, and this will be familiar to you. Broadly speaking, it includes the same contact tracing, isolation, and requests that everyone who has symptoms be tested at a community testing station or at a primary health provider. PCR tests will continue to be used, but we will begin to integrate rapid antigen tests into these sites as required. If you're required to isolate during this phase, you'll receive advice and, if needed, support to do so. In this stage, you will need to isolate for 14 days if you're a case and 10 days if you're a contact. Stage 2 will be a transition stage where we adjust the system to focus much more on identifying those who are at greater risk of severe illness from Omicron, which will be a smaller percentage of cases. At the 3rd stage, when cases are in the thousands per day, we will then make changes to contact tracing, the definition of contacts and isolation requirements. Details of this stage of the outbreak we'll be providing in a full walkthrough with the Ministry of Public Health on Wednesday. But it's worth noting that we don't expect to be at this stage for a few weeks. Through the course of each stage, we have a test-to-work regime that will apply to our essential workforces to keep them going through the outbreak. I know that hearing these sorts of case numbers will sound deeply concerning for people to hear, and of course, we'll do everything that we can to slow the spread and reduce the number of cases we experience as a nation. But it's important to remember that COVID is a different foe to what it was in the beginning. Yes, we're not used to having it amongst us, and we still want to prevent people from getting it. But if you do, because of vaccinations, for most people it will be mild to moderate illness that you can manage at home. Why then, you may ask, are we going to such lengths to slow it down? For the same reasons we've always taken COVID seriously, because we're a team. And some of our team are immune compromised, some have illnesses, some have vulnerabilities, and of course many are older. All of these things means our team will not experience Omicron in the same way. But if one of us doesn't play our part, then someone else may suffer. We are stronger as a team than we are as individuals, and so now I ask that we all pull together again. Please be kind. I know not everyone sees this pandemic in the same way, but for the most part we're motivated by the same thing, and that's looking out for each other. So get boosted, start wearing a mask in all indoor settings, and get prepared to be at home should you need to be. We've spent the last 2 years preparing for this, and today I'm grateful for the position New Zealanders have put us in to fight Omicron. I'll now ask Dr. Bloomfield to give a little more detail on the cases and the information that we have to date. Then, of course, we'll be open to questions, and then at the conclusion of questions, I'll ask Minister Robertson to take the floor.
Thank you, Prime Minister. Kia ora koutou katoa, ngā mihi o te tauhou. So I'd just like to make one more comment about the cases, and then I'm going to talk about locations of interest and testing and so on. The most important thing about these cases is that the first one of them went and got tested, and that's how we know about this group, and that's how we know that this is Omicron, and therefore we can act in response. So very grateful for this, and it is one of the most important things people can do, and you'll hear me emphasise this message again, that anyone who has symptoms, wherever you are in the motu, please do get tested. That has been a fundamental part of our success to date in combating this virus, and it will continue to be so with Omicron. On to locations of interest. The initial locations have been identified so far across Auckland and the Nelson-Tasman region, and these are being loaded up onto our website and will be published as details are confirmed. So please do check the Ministry's website, and we will get the information out through other ways and channels as well. I should say that there will be people from outside of Auckland and Nelson-Tasman who have travelled to these regions, given the time of year it is. And if you have been at these locations of interest, it is just as important that you are tested, or if you are symptomatic anywhere, of course, to get that test. So please do keep an eye on those locations of interest if you've been in Tamaki Makaurau or in the Nelson-Tasman region over the last week or two. There are 5 Air New Zealand flights, which were the original flight the whānau travelled on from Auckland back to the flight from Auckland to Nelson, plus 4 others that the infected flight attendant travelled on. And those flights are NZ 5083, Auckland to Nelson at 5:20 p.m. on the 16th of January, flight NZ 5080 from Nelson to Auckland at 4 p.m. on the 19th of January, flight NZ 5077 from Auckland to Nelson at 2 p.m. on the 19th of January, flight NZ 5049 Auckland to New Plymouth at 7:50 p.m. on the 19th of January, and then flight NZ 5042 from New Plymouth to Auckland at 1:50 p.m. on the 20th of January. And just a reminder that there is still a Section 70 notice in place that puts a legal requirement on people who are contacts and who have been at a location of interest to follow instructions around isolating and getting tested. And as the Prime Minister has said, at this point in time, while we are still in a stamp-it-out approach, that will require cases to isolate for 14 days and contacts for 10 days. Our public health teams are busy conducting interviews with both the whānau and people who were at the events they were at in Auckland to find out how these cases might have been infected and further details of their movements and those of our other cases. However, based on the information we have, and particularly because they attended a wedding in Auckland, we have judged that the risk of undetected transmission is considered to be high, and hence our advice that now is the time to move the country into the red setting under the COVID protection framework. Our contact tracing teams are fully in action, and they're interviewing cases, identifying close contacts, tracing those contacts, and ensuring, most importantly, they are isolated and being tested. As of 11 p.m. last night, 150 of 192 people on those Air New Zealand flights I mentioned have been contacted and provided with information about isolation and testing. And those efforts, of course, continue this morning. There are at least 2 known groups that were infected at the family event, the wedding, and attendees from the wedding are also known to have attended other places where there are high numbers of people. This includes a funeral, an amusement park, Sky Tower, and domestic airports, of course, around the country. I'd like to reiterate that locations of interest are only published where we don't know some of the people there. There will be other exposure events where we know everybody who is there, so that place, that does not become a location of interest and is not published. We do expect the number of cases and contacts to grow. We've seen this with previous outbreaks, with Delta and other variants, but of course with Omicron being highly transmissible, that will happen, and we will learn more from interviews of our cases. We've got additional capacity stood up around our contact tracing. Our public health teams around the country and our central team are working very hard together on that. And in that vein, Healthline is also surging its workforce today and has additional people on duty in anticipation of an increase in call volumes. Please be patient if there is a short wait. Call back later if you can't get through immediately. They will have extra staff on. Please remember, just call Healthline for clinical advice. If you have been at a location of interest at the same time period as a case has been, then seek advice. But they are not there to provide advice around, for example, what the red alert level settings are and so on. That information is all available on the government's websites. And if you want to know the locations where you can be tested, of course, the Health Point website has that as well. Again, just to reiterate the Prime Minister's point that at this stage, in a stamp-it-out approach, our testing is exactly the same as it has been right through the pandemic so far, and that has served us very well. It is our nasopharyngeal PCR swabbing that is done in a range of places and communities, and people will be very familiar with this now. So that is the mainstay of our testing. If you are symptomatic, please seek a test. Our DHBs have all been notified, and they will ensure there is good access to testing today and in coming days. Our teams will closely monitor that and ensure additional capacity is made available if needed. It's important the right people get tested. So please, if you don't have symptoms or haven't been at a location of interest, there is no need to get a test at this point. We need the right people to get tested so we can understand the extent of transmission at this point. I also want to reassure New Zealanders that anyone who needs medical care will continue to be able to receive that, in both in the community and primary care, but also in our hospitals. Our health system and our hospitals have good capacity across the motu. Our hospitals at the moment are 84% occupancy, which is actually pretty typical for this time of year, and ICU occupancy is under 70%. Most of these are people who have had surgery done and so require time in ICU. So if you need care, seek it. Don't hesitate to do so, and if it's an emergency, of course, call 111. And finally, our boosters and public health measures, as the Prime Minister has said, public health measures such as mask wearing and restrictions on gathering are designed to keep us all safe and keep pressure off our health system to protect those who are most at risk of getting sick and ensure that our health system can continue to deliver care that all New Zealanders need. Our plan in this early stage continues to be rapid testing, contact tracing and isolation, and that will help us slow the spread we know. We don't yet know the source for these community cases, and we are investigating what that might be. And the important thing at this point is we find out the extent to which there is spread in the community, particularly in Tamaki Makaurau. So it's essential that anyone with symptoms or who has been at a location of interest does get tested. Finally, and just to reiterate the Prime Minister's comment, it's more important now more than ever that everyone right around the country continues to play their part, as they have for the last almost exactly 2 years. If you wonder if that makes what that means for you, or if what you do makes a difference, it most certainly does. And thank you in advance for your support.
All right.